Hi, my name is Michelle Allen, and I'm going to be presenting Practice Makes Perfect, incorporating infection control, evidence-based practice, and simulation. This is my capstone presentation for the College of DuPage Nursing Department. I'm a Benedictine University MSN Nurse Educator graduate student. The first slide presents learner outcomes. These are the goals in which, upon completion of the program, I hope that you are able to master. This project started as a discussion with Donna P. about staying current in nursing practice and products. From there, it blossomed into the specific infection control areas of central line, Foley catheter, and tracheostomy site infections. Research included evidence-based practice literature review, interviews with College of DuPage clinical sites, and assessing current College of DuPage nursing practices. Interviews with College of DuPage clinical sites found that orientation for a new graduate is approximately 9 weeks. Creating congruency between didactic simulation and clinical education can offer quality patient outcomes. Furthermore, we can support our students by incorporating evidence-based practice to better prepare them for clinical and postgraduate nursing careers. Costs as far as general infections, it's $5.7 billion to $6.8 billion annually. Deaths are about 99,000 per year, and healthcare acquired infections are absolutely preventable, such as an example, central line associated bloodstream infections. Devices such as alcohol-impregnated caps and chlorhexidine, and as well as impregnated sponges with chlorhexidine, are increasingly being used to prevent infection in healthcare settings. If we're educating our students earlier, we can empower them to become infection prevention champions. This picture demonstrates the various CLABSI products that College of DuPage nursing clinical sites are using. In the upper left corner is a PIC StatLock holder, followed by chlorhexidine impregnated sponge. The circular sponge is known as a biopatch. Above this is alcohol impregnated caps, which are meant to go on IV hubs and eliminate scrub the hub issues, such as being performed less than the recommended 15 seconds. Under the StatLock is a Tegaderm dressing containing chlorhexidine. Next to this dressing is another StatLock for a PIC with foam. There are many ways that you can prevent catheter-associated urinary tract infections, as they are a majority of hospital-acquired infections and are costly, as well as increase length of stay for our patients. Prevention of CAUTIs can begin with proper insertion techniques, specifically using a Foley catheter that has more than one hole offers a spot for more urine to drain from, which prevents urine from accumulating in the bladder. As an example, your clinical site, Edward Hospital, uses silver Foley catheters. A rehab hospital in northern Arkansas found that using silver ionic Foley catheters decreased a patient's risk of developing a CAUTI by 100%. However, there's a significant price difference of $28,702 per year if the hospital uses silver catheters as opposed to the standard catheters. After insertion, securement devices prevent movement, which prevents infection, irritation, and backflow of urine, which in the end is going to prevent your catheter-associated urinary tract infection. picture demonstrates various devices that prevent caudis. All of these devices are various securement devices. The Foley anchor is manufactured by Centrion. The stat lock is manufactured by C.R. Bard, and the Cast Secure is manufactured by the M.C. Johnson Company. So, for tracheostomy site infections, this tends to be an area that is not often discussed, but is extremely important to properly teach our nursing students. If a patient develops an Acinetobacter species infection in his or her respiratory tract, their mortality rate is 19 to 54%. An update in nursing practice is to use hydrocolloid dressings as opposed to the gauze to decrease risk of infection. As if the stoma is wet, bacterial growth is promoted, leading to wound and chest infections. As a result, clinical facilities are using hydrocolloid dressings to prevent moisture at trach sites. This picture demonstrates the products that are being utilized to prevent infections at the tracheostomy site. To the left is the pink Polymem, and to the right is the beige Mepilex. Both products come in various sizes, though Polymem can be specifically cut to fit under and around the trach. The Polymem is non-adhesive, whereas the Mepilex has adhesive borders and can sit under the trach where most skin breakdown, mucus, and infections are located. Telephone calls were given to all 11 clinical sites to establish a time to meet and discuss face-to-face institution infection control measures, though 5 responded back to take part in the discussion. The discussion had provided 4 standardized questions. The following slides specifically talk about the questions that I had asked each of the institutions regarding their products, their manufacturers, improvement or lack of improvement since implementing the products, as well as a question regarding student use of products. This page discusses a comparison of the College of DuPage nursing department and clinical site products, just a side-by-side discussion of what products are currently being used at both places. So this slide talks about how can we promote better education for our students? How can we close the gap and enhance the curriculum? One of the most difficult things is providing cost-effective education, especially when it comes in the form of samples that can be pretty pricey, or products that can be pretty pricey. So ask for samples from the manufacturers and purchase in bulk. If these new products, though, do cost too much, have a sample on a task trainer and incorporate it within skills lab or simulation teaching. If you are a didactic instructor, you can pass around the products like a show and tell during lecture about healthcare-acquired infections and discussion about prevention. In addition, an online scavenger hunt performed by students will help them identify current infection control evidence-based practice measures. Thank you so much for the opportunity to discuss infection control evidence-based practice measures. and I'm incredibly grateful for my time at College of DuPage as a MSN nursing student. I'm incredibly appreciative to Donna and Teresa, as well as the simulation staff and the faculty for helping enhance my education, as well as help me become a better faculty member. Thank you so much, and I appreciate your feedback on the evaluations. The following pages are references. You may look up these references as well as look at them in the binder that I am providing you. Thank you so much for listening to this presentation, and have a wonderful day.